We are live now.
Great.
So good afternoon, everyone. Thank you for joining us today. So today we have with us Simon Swigert, our COO of IHM, and Gion Stross, who is the Marketing and Sales Manager at IHM. So thank you so much for joining us. So Simon will take us through this presentation. And if you have any questions or queries, you can write them out in the comment section, and we will definitely address them at the end of the session. So thank you again to each and everyone for taking the time out. So I hand it over to Simon now. So Simon, thank you.
Thanks, Bodhi. Thanks, Gions. So thanks for joining us today on, and for those on our Facebook live stream as well, welcome. And those who have joined us on Zoom, welcome as well. So we're going to go through a little bit of a discussion presentation, first of all, some slides, and a bit of a discussion about nursing registration, the changes that are happening with nursing registration, and then IHM's brand new pre-registration or preparation course for the new registration system in Australia as well. Okay, so we'll go through those three things, and then, as Bodhi said, Gions and I will answer any questions that you may have as well. Hopefully you'll then leave here with a lot more information about the system, and then you can also talk to us directly if you want to about each individual case. So let me get started first of all. Bodhi, do you want to make the screen, maximize the screen, or are you, that's it.
I think this is the maximum.
This is the max.
I'll try again.
Yeah.
Okay.
Okay, perfect. Okie doke. So first of all, one thing that's really important to us is that you understand, you know who we are. So we are the Institute of Health and Management, and I'll use the acronym IHM for make it a bit easier. So IHM is based in Australia, based in Melbourne, Australia, and we have three campuses: one in Sydney, one in Melbourne, and one in Perth. We were founded in 2012. And accredited by TEQSA, which is the regulator for higher education in Australia, in 2015. So since then, we've trained over 1,500 nurses, 1,500 nurses in the last 12 months to finalise their registration in Australia. Okay, so that's a lot, and they're all internationally qualified nurses who are working and trying to realise their dream of living and working as a registered nurse in Australia. Okay, but the nursing registration process in Australia is changing, and in beginning of this year, in March of this year, just as COVID started to really bite and hit in Australia, the Nursing Midwifery Board, which is the NMBA, started to move and transition to what's called OBA, or outcomes-based assessment model, for internationally qualified nurses and midwives. Okay. So previously, you would have probably be familiar with the old IRON course, IRON, or the new version of that course, which is called EPIQ-RN. Okay, and that bridging course is a 12-week course that you take in Australia on campus, 6 weeks in the classroom, and 6 weeks working in hospitals in acute settings. Okay, so that 12-week course is now being replaced by the OBA, or the outcomes-based assessment. So let's talk a little bit about what this change is all about. But first of all, as I mentioned to you, now just go back one slide, Bodhi, if you could, that'd be great. So as I mentioned to you, we have three campuses in Australia, and you can see them down in the bottom right-hand corner: Australia, Melbourne, Sydney, and Perth. We also have offices in India, which I'm hoping many of you know already, and we have a number of offices in India. We have an office in Dubai, an office in the Philippines, Nepal, and Colombia in Latin America, which is way on the left-hand side of that slide as well. Now, all of those are both marketing offices, as well as training centres, as learning hubs, and support centres as well. And we'll talk about that a little bit later. So now let's take a look at the OBA process. So OBA, and I'll say that again, outcomes-based assessment. Essentially now, the registration process comprises 5 steps. 5 nice, easy steps, hopefully. So step number 1 is what's called a self-check. And this is where you can go to the AHPRA website yourself and register yourself on the AHPRA website and they do what's called a self-check, which means that you provide AHPRA with some basic information about your qualification, your language level, your nursing registration, and they will then advise you on screen, so immediately, as to whether you're eligible for registration in Australia, or if you need to do additional language training, additional academic training in order to meet the minimum eligibility requirements for nursing registration in Australia. The minimum requirements for nursing registration in Australia are 3 simple things. Number 1 is you must have IELTS 7 language, or OETB, or PTE 65. So one of those 3 tests of English, IELTS 7, PTE 65, or OETB. That's the first thing. The second thing you must have is a bachelor or a level 7 qualification or above. So that's a bachelor, level 7 or above. So if you are a GNM, so if you hold a 3-year nursing degree, diploma from India, for example, that is a level 6 qualification, which means when you do the self-check, the website will tell you that you're not eligible for registration. But it means now you need to do some further education to reach either a level 7 or a level 8 qualification in order to be eligible to register with the Nursing Registration Board. And I'll talk a little bit later about the pathway for you to enroll into a level 8 qualification, which is the graduate diploma in nursing, in order to reach that level 8. So essentially you go from your level 6 diploma and you jump over the bachelor and go straight to a level 8 qualification, okay? So that's the first step. It's like a self-assessment. The third piece of information that is important is your registration certificate. So are you registered in your country where you did your training, or in the country that you're working in at the moment? So as long as you've got those big 3 to begin with, you'll simply click the boxes on the website and that will tell you whether you're eligible or not. If you're not, what you need to do to become eligible, okay? So once you've done that and you've worked out what you need to do, if you're a GNM, you will then obviously need to complete the level 8 graduate diploma qualification. Step 2 is where you actually apply for registration. So you, again, through AHPRA's website, you upload all of your documents, all of the relevant documents they ask for, provide all of the information about names, address, etc., upload your documents, and you pay a fee of 640 Australian dollars. Now that's an assessment fee. So that's for the AHPRA folks to then go and review your qualification, review your nursing registration. And when they review your qualification, what they're reviewing is, does your qualification meet the same standards as the Australian equivalent qualification? Okay, so if it's a bachelor, does your bachelor qualification from, say, India, meet the same standards as the Australian bachelor qualification? Okay, and they have mapped all of the all the bachelor programs from around the world against the Australian standards, and they can then tell that your bachelor degree is mostly consistent or not at all consistent. So you pay your $640. And AHPRA will then send you an email essentially to say either you are eligible to apply or to be registered as a nurse, but because you are trained internationally, so outside Australia, you must complete OBA or an assessment of your skill. Okay. So it's only for countries like the UK, New Zealand, UK, Canada, US, etc., where there may be an exemption on needing to do OBA, but that's only if you've done your nursing qualification in one of those countries, okay? So that email will come to you, and then you will know exactly what you need to do, and for most overseas trained nurses, that will be to complete OBA. Step 3 is an online orientation program that you will need to complete, which is to begin your introduction to the Australian healthcare environment and context. So you'll be sent a link and you will join this online course, which you do at your own time, at your own pace. And that will be talking to, and you will be basically covering learning and then answering some questions, some mini assessments and things as you work through this orientation. And that again is to begin your familiarization with the Australian healthcare system, standards, how healthcare is provided, how nursing care is provided in Australia. So that's step number 3. That doesn't cost you any extra. That's part of your assessment fee, okay? Step number 4 is where you begin to then show your great skills and your great capability as a nurse. So step number 4 is the NCLEX RN MCQ, which is multiple choice question test. It's an online test. So you complete that test at any Pearson VUE testing center. So any of the Pearson testing, the PTE or Pearson testing centers, you simply book a time on the AHPRA website and then 2 or 3 weeks later, go to the Pearson testing center to take your test, okay? The online testing fee is approximately $200 US, and there's an additional $150, what they call a scheduling fee, because you're doing that outside Australia. So that'll be $350 US, so about 450 Australian dollars for you to take the NCLEX RN MCQ test. That's the first part. You don't do that in Australia unless you're already in Australia. So you would do that at any Pearson testing center, wherever you are in the world, Dubai, London, wherever it may be, okay? So that's step number 1 in the final 2 steps toward registration. When you pass your NCLEX RN MCQ test, and you will know within 24 hours if you've passed, you will then be invited to reserve or book a time for your 1-day OSCE assessment in Australia at the Adelaide Health Simulation Centre. Now, Adelaide is in South Australia, which is down between Victoria and Western Australia, okay? And that's a 1-day assessment at the Adelaide Simulation Centre. And during that 1 day, you'll do 2 different things. The first thing you'll do is you will complete 4 simulation sessions. So in other words, when you arrive and you've done all the registration things, you will be given 4 scenarios in which you then need to, for 20 minutes, demonstrate how you will provide nursing care to what will probably be a live patient in a simulation room, okay? There'll only be 3 people in that room. 1 will be the patient, 1 will be you, the nurse, and 1 will be an assessor from AHPRA, who will then be assessing your nursing skills and practice as you explain how you are providing nursing care to that patient based on the scenario. Now, I'm sure you've probably all done scenarios during your nursing training, so you're probably quite familiar with them, and they're not dissimilar, but these will be testing your skill to Australian nursing standards and practice, okay? And there are differences between the nursing practice in India, Australia, the UK, Singapore, Malaysia, etc., you know, Kuwait or wherever it may be. So there are differences as well. The second part of that 1 day is you'll do 2 clinical tests. So just 2 clinical tests to demonstrate that you have good level of clinical skills, okay? The cost for that full 1 day is 4,000 Australian dollars. And that's a fee that you will pay when you book your date for the OSCE assessment, okay? Now, there are going to be a few restrictions on the number of times you can take the NCLEX test and the OSCE test. Now, we don't have the firm details as yet because with COVID-19, the rollout of the OBA has been delayed a little bit, and what we think will be until probably July next year, okay? But if we look at the UK, with the online test, you can take that test up to 3 times before you then need to take a 6 or 12-month break before you can take the test again. And that's primarily based because if you have 3 attempts and you still can't quite pass, you need to go away and learn and then come back and try the test again. The same applies with the OSCE test as well. We understand it might be up to 3 times that you can take that test, and then you need to go away for 12 months before you can reapply for registration. And again, the logic in that is if you're not able to pass the simulations, you need to go away and do some fairly decent study in order to then come back and apply for registration again. Okay, so that's the 5 steps of the new registration process, all fairly straightforward. Steps one and 2 are the application. Step number 3 is where you begin your learning and your understanding of the Australian nursing system. Step 4 and 5 is where you get to demonstrate your great skills and your great knowledge as a nurse. Now, all of these steps 4 and 5 are not meant to be easy. They're not meant to be turn up and I'll pass and everything will be fine. They are meant to test your skill, and they are meant for you to demonstrate that you are a nurse who can practice at the same standards as other nurses in Australia. Okay, so preparation is really important, and we're going to talk about that now, is about the preparation course. Okay, thanks, Bonnie. Okay, so just to reiterate for you, the 5 steps we just talked about. Steps 1 and 2 are getting yourself registered, getting yourself in the position where AHPRA will issue you with what's called a decision letter. Okay. Step number 3 is where your decision letter comes along and you complete your orientation. Step number 4 is the 2 steps of the OBA process. One is the NCLEX, the second is the 1-day test. And step number 5 is the best news in the world. You've got your registration and you can then start to realize your dream in Australia. Next slide, thanks, Bodhi. Okay, so as I said to you earlier, preparation for NCAP or for, the OBA is really, really important, okay? Now we realize 2 things. Number 1 is you're working and shift rosters are tough. Number 2 is you probably also potentially have family, family and spouse and husband or wife, etc. So you need to mix a whole lot of things together. So when we've been looking at how we design our preparation course for the OBA, we've tried to mix all of these considerations together so that you can learn and practice, but also fit it in amongst your busy life, okay? The program we've developed is called NCAP, which is the Nursing Career Advancement Program. And this is NCAP for OBA, which is outcome-based assessment, okay? The program comes in two parts to fit with the two stages of the OBA assessment process. The first part is to prepare you for NCLEX MCQ, and that's the online test. Remember, you take that test online. Only if you're in Australia do you take it in Australia. Otherwise, you take it wherever you're working or living at the moment. And this course will prepare you for that online test. It will also prepare you and train you in Australian nursing practice and standards. So we've taken a different approach. Instead of just purely teaching you test strategies, so how to pass the test and what are the strategies to pass the test, we are going to teach you the fundamentals of Australian nursing practice. So then you will be able to pass the test because you'll know the answers and you won't have to worry so much about what is the pattern. What is the pattern of the test? You will know the answers to that test. So we'll teach you about the test and test strategies. We'll also teach you about advanced nursing practice in Australia. The second part, which you do in Australia, will be a focused, intensive, clinical OSCE preparation, classroom to lab, lab to classroom, 5 days per week for 6 weeks. And that's a very intensive program where you will be in Australia and you'll be taught by Australian registered nurses, normally at a master's level, who have been through these processes and will then teach you and demonstrate, and you'll practice and you'll practice and you'll practice again, the Australian nursing standards. Okay, Bodhi, let's take a look at each of those courses individually. So I talked about the first part. The online course is over 12 weeks. There's 1 week orientation, but it's a 12-week course overall. There'll be 3 units that you'll cover. One will be teaching you about the exam specifically, so the MCQ exam. The other 2 units, nursing care in Australia and nursing and healthcare system in Australia, are teaching you advanced nursing practice. So they're teaching you about the nursing care processes and systems in Australia, about the Australian healthcare system, and about how nursing practice is done in Australia. There are differences between nursing care in India, Australia, Dubai, Philippines, London. Okay, there are differences, and that's what the OSCE assessment is doing, is for you to demonstrate that you understand what those practices are. The only admission requirement is that you are currently a registered nurse, either in your home country or the country in which you're working. Okay, 12-week course. The cost is $3,500, and it's 12 weeks online. Okay, and that would be approximately 3 days per week. You will have a 2 to 2.5 hour tutorial session, 3 days per week. And then there'll be self-directed learning exercises. You will then study online, and then you'll join the next tutorial. Okay, it's designed to build your knowledge step by step. Okay, so that's the first part, 12 weeks. The first intake for that course is on the 7th of September. Okay, so you've got 3 weeks to join the next intake for that course, which means if you're starting on September 7, you'll be finished by November 7. I think if my maths is correct, September, October, November. So you'll be finished, actually you'll be finished early December. There you go, sorry, my mistake. So 3 months, by then you'll be ready to move on to the next stage you'll be then ready to take your NCLEX test, and then you'll be ready to move on to the second stage of your training. And the second stage of the training, as Bodhi clicks, beautifully done, is the OSCE assessment. And this is what I was talking about earlier, 6 weeks on campus in Australia, in either Melbourne, Sydney or Perth. And it's 6 weeks of intensive OSCE training and preparation. Classroom in the morning, lab in the afternoon, lab in the morning, classroom in the afternoon, all taught to you by highly qualified nurses. Most of them are master's qualified nurses, and they'll be teaching you and demonstrating, and you'll be practicing and practicing and practicing. Okay, simulation testing, OSCE testing, etc., etc. The one unit you can see there says it all, OSCE training and assessment. Okay, the course fee for that is $5,500 for the 6 weeks of intensive training. That is 5 days per week. Okay, you're not on a student visa. It's 5 days per week for 6 weeks. So 30 days of intensive training, 7 hours a day. Okay. The only requirement again is that you are a registered nurse in your home country. But by this stage, you already will have a decision letter, because you will potentially have already applied for registration. And because you will have already done the NCLEX test, then you'll be getting ready for your OSCE test. Okay. So this is a 6-week course, and one of the options is that you might do this course, you might come to Australia on a 3-month visitor visa, do this course for 6 weeks, and then 1 or 2 weeks later do your OSCE assessment and your OSCE test in Adelaide. Thanks, Bodhi. Okay, so why choose? We've talked about the nursing registration process. We've talked about the preparation course. So why on earth should you choose IHM? There are other providers in the market who are offering preparation courses, but what we offer is different. And there's 4 very good reasons why it's different. Number one is that we have, in our view, probably one of the most experienced and highly trained faculty in Australia. All of our lecturers are registered nurses. All of them have practiced at a senior level. Most of them are master's qualified. In fact, I think all of them are master's qualified. So they've all practiced as nursing leaders, clinical leaders, ICU, PEDS, etc., etc. So they're all highly skilled and highly qualified. Very important point for you to remember, IHM focuses just in nursing and healthcare. That's our specialty. We don't try and do hospitality. We don't try and do mechanics, engineering, IT, other things. We focus in healthcare. And that's because we believe if we're going to do it right, we're going to do it best by focusing in one sector, and that's healthcare. We've been training in healthcare since 2007. Now that's 14 years. So we are very well known in the industry as well. The second point is an excellent online platform. The first part of the NCLEX preparation is online for 12 weeks. Our platform is probably one of the best platforms in Australia. We have at any one time 500 or 600 students studying using that platform every day. We have a large number of our students studying our postgraduate course online, and every week they attend lectures, every week they submit assessments, every week they attend support sessions with their lecturers as well. The feedback we get for our online platform is very, very good. And it's very important that you should ask the question about the online platform anybody is using, because if you're going to study online, you should have the same experience as somebody who's studying in a classroom. And that's our commitment to you. This next point, state-of-the-art facilities and amenities, so state-of-the-art nursing labs. And this is important for the second part of the OBA course, where you are in the nursing lab and the classroom as well. So we have nursing labs in Melbourne, Sydney, and Perth, okay? Our nursing labs are as good as, and to be honest, they're better than some hospitals I go to, okay? So they are multiple beds, anywhere from 6 beds to 8 or 10 beds. We have OSCE assessment rooms set up in each of the campuses, Melbourne, Sydney, and Perth. So when we do this training, you will be in exactly the same environment as you will find when you go to the OSCE testing centre in Adelaide as well, okay? The fourth point is 24 hours, 7-day-a-week student support. Now, we know if you're working and you're looking after the family, etc., you probably don't sit down to do study until 8 or 9 o'clock at night. I know when I study online, I do. I know Gion's does, because I see Gion sitting up at 1 a.m. in the morning submitting his assignments, okay? So you want student support when you're studying, not because it's between 9 and 5 in the afternoon. So our support is available 24 hours a day, 7 days a week. If you've got an IT problem, they're available. If you want to talk to somebody about where can I find some resources, you've got that question answered 24/7. If you want to connect with a lecturer, they'll try and connect you with a lecturer somewhere in one of our campuses in the world. So they're able to give you have a discussion with you about that next assignment, that next assessment at the time when you're studying, not when our office is open. And that's really important. Now we use Zoom, we use Microsoft Teams, and they are readily available platforms as well. So 24 hours, 7-day-a-week student support. Our job is to be there for you when you're studying, not when it suits us, because our office is open, okay? So there's 4 good reasons to choose IHM. And as I said earlier, the fifth and probably the most important is because we specialize in healthcare. That's our space. That's what we do well. Okay. Thanks, Bodhi. So let's talk a little bit about why would you be thinking about coming to Australia? You pass your assessment, you get your registration. What's the next thing you need to find? You need to find a job. And you want to find a good job. You don't want to just find any job as well. But first of all, let's talk about what is happening in Australia as far as the healthcare workforce. So there is a very strong demand for nurses in Australia. There's an even stronger demand for specialist nurses in Australia as well. And that could be that might be specialist nursing in aged care, specialist nursing in pediatrics, ICU, etc. COVID-19 has really put a lot more focus onto the nursing workforce in Australia. It's put a lot more focus onto ICU, because COVID obviously is a respiratory disease as well. So ICU, ventilators, a lot of that specialist equipment that you need to be trained in. And that's where the future, a lot of the future work involves as well. If I'm going to look at some numbers, the first column you'll see there is the nursing workforce over the next 5 years is going to grow by about 30%. Okay. However, Australia can't train enough nurses. Our university places are almost full and we still can't train enough. So we need about 30,000 extra nurses per year in order to keep up with the demand of the Australian healthcare system. What do you think the average age of a nurse in Australia is? The average age of a nurse. Most countries it's 35, 40, you know, because a lot of younger girls and boys get into nursing and they start young. The average age of a nurse in Australia is 57 years old, 57. The retirement age in Australia is 65. So over the next 8 years, a large number of nurses are going to leave the nursing workforce, okay? Also, a large number of the nurses that we have in Australia at that, 280,000, they work part-time. They don't all work full-time. So they do 20 hours per week, 1 or 2 shifts a week. They don't do 40 hours per week. So when you've got many people working less hours, you need many more people as well. But the primary reason the demand is so strong is, and Bodhi will just click on the slide, is because guess what? Australians are aging. The Australian population is getting older. As I said, the average age of the nursing population in Australia is 57. If I look at a country like India, for example, India's the reverse of Australia. The largest group of population in India is under 18 years of age. And you think about in your neighborhood, you think about in your community, the largest group of people in that community is probably under 18 years of age. So India's got this huge workforce coming through for the next 2 generations. In Australia, the largest part of the population is over 60. Okay. The smallest part of the population is under 18. So we've got an aging society and we've got a reducing number of people ready to enter the workforce. The piece in the middle is where internationally qualified nurses will fill that space. And that's exactly why hopefully you're talking to us and exactly why you're listening to this stream today as well. So Australians are getting older, people around the world are getting older. As age goes up, so too does the amount of care people require, the amount of hospital time they need, and the skills and professionalism of the nurses required keeps increasing as well. Thanks, Bonnie. So we've talked about 3 key things. We've talked about the changes in the registration process. We've talked about how do you prepare for that through the NCAP course. And then I've given you a little bit of information about where the job opportunities are in the future as well. And we see a very, very good job opportunities in Australia. Let me just give you one little piece of information because I know a lot of people, a lot of nurses who work overseas, they might be working in India, the Middle East, Southeast Asia, UK, etc. One thing I keep hearing is nobody respects nurses. They always it's always doctors here, nurses here. Let me tell you, the year before last in Australia, the Australian government did a survey which asked one simple question. What is the most trusted profession in the country, in Australia? So as you could imagine, bank managers were somewhere near the middle. Real estate agents were a little further down. Car salesmen right down near the bottom. The second most trusted were doctors. And the first most trusted were nurses. The most trusted profession in Australia was a nurse. And that was about 1 million people in Australia voted and said that and came up with that finding. So when you talk to someone in Australia and they ask you, what is your job or what is your profession? And you say, oh, I'm a nurse. They'll be interested in what you do. There'll be a respect for what you do. Doctors and nurses work side by side together, not a doctor here and a nurse here. Side by side together in what's called basically what's called a working team or a multifaceted team, which brings doctors, physios, nurses, specialists together to then treat patients. Okay, so nurses is a respected profession. It's a highly regarded profession, and I will say COVID-19 has put a real focus around the world on the fantastic work that nurses do in all facets of healthcare as well. So hopefully we've given you a bit more information about how you can start to realize your journey to work and live in Australia. The first step, you must be registered, okay? For those of you who are GNMs, you'll need to do some more education. So you'll need to get from your level 6 qualification to above a level 7 qualification. And the graduate diploma in nursing is the perfect way to do that. And that's delivered by IHM also. So that's a 1-year postgraduate course that is available online or on campus in Australia. Now you can commence that course online and then join us on campus a little bit later when the borders open in Australia, or you can do the whole course online wherever you're living in the world. There's one thing to remember with Australian education is that it's the same course online as it is on campus. There's no difference. So when you receive your certificate, you will receive a certificate from the Australian government, which says you have completed this course. There's no distinction between it's online versus on campus. Okay. And that we know that's important because a lot of nursing boards ask that same question. Did you study online or did you study on campus? In Australia, it's all about, have you completed the course and met the assessment criteria? If so, you've passed the course. Now you can take that GDN course and you can add one more year and complete your master's. And that would then be a Master of Nursing in Australia, okay? And you can do that course again on campus. If you study that course 2 years on campus, you're then eligible for a 2-year post-study work visa. Now, the post-study work visa means that once you have completed your 2-year master's course, you're then able to live and work in Australia for another 2 years. And you may choose then to apply for permanent residency during that 2-year period, okay? Now, because of COVID-19, getting to Australia, it's not possible, unfortunately. The borders are closed, but we do know that they will open up again. What the Australian government has said is, if you commence your 2-year master's course online, you can commence online and then come to Australia whenever the borders open and join us on campus. And all of that time, online and on campus, will carry towards your post-study work visa. Okay, so you might start studying in Dubai, do 6 months in Dubai, and then come to Australia to join the second semester in Australia, and then on to your master's on the 2nd year. And that whole 2 years will count towards your post-study work visa, whether it's online or on campus. Now that's a really, really good situation, because if you want to get started now, and I'd strongly encourage you to do that, use the time during COVID. We're all locked down in different ways. Get started, finish in Australia, 2-year post-study work visa, and away you go. Okay, so that's something to think about and keep in mind, particularly for GNMs who are not currently eligible to apply for registration as a nurse in Australia. For bachelor qualified nurses, that will take your career right to the next level. You will be a master's qualified nursing specialist. And that, as we said before, is where the demand is. If I look at salaries of nurses, and money's important because we all need to get paid to work, a regular registered nurse in Australia will be paid somewhere between $60,000 and $70,000 per year, depending on the shifts you do, how many night shifts you do and things like that. If you are working as a master's qualified nurse, you'll be earning somewhere between $90,000 and $100,000 per year. So it's about a $20,000, $25,000 difference for 2 years of study. It's a small investment for a long-term gain every year if you're earning $25,000 to $30,000 more working as a master's qualified nurse in Australia. If you wanted to, at some stage, as a master's qualified nurse, you can also join the education sector and come and join us, and then you can be teaching nurses in the postgraduate, in the diploma, bachelor, or the postgraduate course, okay? So those options are there, and I suggest you have a chat to your IHM consultant who can then tell you about the master's program as well, or you can check it out on our website, ihm.edu.au. So that's the information I had to tell you today. Thanks for listening. Now, if we've got any questions, please put them in through the chat. Bodhi's going to moderate this, so we sort of group some questions together, and hopefully we can answer, and Gions and I can answer some of those questions for you. So fire away.
Thank you so much, Simon, for simplifying the process for all our viewers. So the first question that we have is from Prab, and her question is, she has completed GNM from India, and she has just completed GCN from IHM. So she wants to know if she's eligible to undertake this program with us, NCAP OBA.
Okay, so first thing you would need, first answer to your question is yes, you are, because you now hold a level 8 qualification, okay? So what I would be suggesting you do is, first step to do is to go to the AHPRA website and complete the self-check, okay? do the self-check and just confirm that all of the upload, all the information you provide will mean that you're eligible to apply for registration. Then once you've done that, then of course you're eligible to apply to complete the NCAP Part 1 and NCAP Part 2 of the course. And congratulations on completing GCN as well. Well done.
Yes, thank you. Thank you, Simon. So another question is from Parina. So she wanted to know our NCAP OBA's first section, NCLEX preparation. So what is the course fee?
The course fee is 3,500 Australian dollars. So that's for the full 12 weeks. And that includes full 12 weeks, access to resources, educators, 24/7 support, etc. So everything we've talked about, all included in that 3,500 Australian dollars. Remember, it's 100% online, okay? And then you have that 24/7 support. So when you're studying, the support is available to you as well.
Thank you. Thank you, Simon. So another viewer, her name is Chaitanya. So she wants to know more about NCLEX RN details, the MCQ details like exam fee, pass percentage criteria, or sample question structure.
Goodness, so many questions. Well, Gions, do you have a few more insights into how the MCQ sets up?
Okay, so far, only few exams has been happened for NCLEX exams in Australia. So the pass percentage, to give you a percentage, we exactly don't have that data. But as Simon mentioned before, with the insights which we have from other countries, those who have appeared for this exam without a preparation, very less percentage of them has gone through it in the very first attempt. So as all other profession, all other things, like we need preparation for this course. So NCAP course is especially designed to help nurses to prepare for this exam.
So I think if we, as Gions mentioned, we've got UK data to work on. If we look at the UK data, it's somewhere around about 40% of nurses fail on their first attempt at the OSCE process in the UK. Okay, so that's 40% who have, number one, invested a lot of time to start the process, and secondly, invested a lot of money in paying to do the NCLEX test, and then etc. So 40%, it's about 40%. Those who pass on the second attempt increases, the number who fail after the second attempt decreases to about 20%, and the number who fail after the third attempt is about 10%, okay, 10 to 12%. So that first time, if you do not prepare, and even those who do prepare, 40% still do not pass. Okay, and what that tells me is the preparation is not so great for a percentage of those as well. Okay, Australia, as Gian said, very few people have taken the test, and we just don't have the data available because COVID-19 has interrupted the introduction as well. But in the UK, it's a very good indicator. Australian system will look very similar to the UK system. Okay, 40% don't pass. If you do not prepare, it's a bit like going to the casino, I think. Hopefully that answered your question. The structure, it's a multiple choice question exam, okay? So if you could imagine pretty much any online multiple choice question exam, you won't be able to buy the pattern. It's what they call a dynamic test, okay? So you are basically, it's assessing your knowledge of the Australian nursing standards, your knowledge of Australian nursing practice, okay? You get to demonstrate it when you do the OBA test in Adelaide. This is asking you multiple choice questions, and they will ask you, because it's a cognitive test, they'll ask you the same question in 4 different ways, in 4 different parts of the test. Now, you're meant to get the same answer each time, okay? And that's how a cognitive test works. It's there to test your knowledge and your understanding, okay?
Thank you, Simon.
Great.
And another question that we have is regarding the OSCE Centre. So when will the OSCE Centre open?
So the OSCE Centre, we don't expect will be open until, they won't be offering nursing OSCE until we think maybe July next year, okay? The OSCE Centre already exists. The University of Adelaide, which is where the OSCE Centre is, already does testing for doctors and various health professions, okay? So they already do OSCE testing for different professions. So that centres already exists. Now they're doing, AHPRA has asked them to then do the nursing testing as well. But we don't expect they'll be starting to do OSCE testing for nurses until July next year.
Thank you, Simon. So Reshma wants to know, so compared to the bridging program, what are the advantages of doing OBA?
Okay.
And is it easier than the bridging program?
Reshma, very good question. So let's just separate the two out, okay? So Reshma, can you just into the chat box, can you just put me a yes or no? Do you currently have a decision letter, Reshma?
I think Reshma is inquiring for her sister.
Okay, so does Reshma's sister have a decision letter?
She doesn't have a OET.
Okay, so Reshma's sister. If your sister does not have a decision letter, then when she goes through the registration process, she will be asked, she will be told, she'll only be able to do the OBA, okay? AHPRA stopped issuing decision letters for the bridging course on the 20th of February this year. Okay, so anybody who applied after the 20th of February, AHPRA will no longer be issuing decision letters for the bridging course, only for the OBA. Okay, so that kind of narrows the options down for your sister. She'll need to do the OBA preparation. Are they going to be easier? It's about the same, Reshma. It really is about the same. The 2 units, for example, that we have in the OBA, in our OBA preparation course, the NCLEX part, are very similar to the 2 of the units that we deliver in the bridging course on campus. Okay. When we do the 6 weeks on campus in Australia, it's the same intensity as if you were going into a hospital for 6 weeks of clinical practice. 5 days a week, 8 hours per day. Okay. So they're very, very similar, but if your sister does not have a decision letter, now when she applies, she'll be directed only towards the OBA. Okay.
Yes, thank you, Simon, and I hope he has answered your question, Reshma. If you have any other question, you can just type it here.
Yeah, just drop it in.
Answer it. And another question that would actually help a lot of our viewers would be, can they do this NCAP OBA preparatory course online?
So the answer to that is yes. They can do part 1 online, which is 12 weeks 12 weeks online course. The part 2, they need to do in Australia face-to-face. Okay. And that's because it's practical. They're practicing testing. So that needs to be done in our labs in Australia. But part 1, 12 weeks, 100% online. Okay. 3 days per week, 2 to 2.5 hours per day of tutorials and lectures. And then 24/7 support whenever they need it.
Yes, thank you. I think, Simon, that's about it. We do not have any questions.
Good.
Okay.
So either we've told them we've given good information, or everyone's totally confused, one way or the other.
I think it's the first part. I think you've done a very, very, very good job at simplifying the process for our students so that it's better for them to understand and it's easier for them to grasp the whole new thing, the changes that are here. So, okay. Thank you, Simon. Thank you very much for taking the time out. If our viewers have other questions or queries, they can always send us an email at enquiry@ihm.edu.au, and we will definitely respond to all their queries and questions. And that's about it then. Thank you so much. It was a pleasure having you. And thank you so much, Gions. Thank you. Thank you to all our viewers. Have a good day ahead then.
Good luck in your journey to Australia. Thank you.
Thank you. Bye.